Welcome back to the third and final day of HMA 2021. For our next session, we'll be hearing from Mr. Rob Walton, who is the President and Chief Executive Officer of GE Healthcare Asia, as he shares with us how to build intelligently efficient healthcare systems for the future. So without further ado, please join me in welcoming Mr. Rob Walton.
Hi there, as Noah says, my name is Rob Walton and I'm the President and CEO of GE Healthcare Asia Pacific. As many of you know, GE Healthcare is a leading medical technology and diagnostics innovator. We're one of the world's largest medtech companies with around $17 billion of revenue, primarily focused in the areas of diagnostic imaging, ultrasound, pharmaceutical diagnostics and acute care. And this includes anesthesia delivery and clinical care ventilation. We're a pretty big company operating on a global scale, but we try and pair this with localized operations, and we've got about 50,000 employees spread across 160 countries, and this allows us to tailor our offerings and really be responsive to the distinct needs of the customers in each of the regions that we operate in. We've also been around for a pretty long time. We've got more than 100 years legacy of innovation, and as part of this, we've developed one of the world's largest installed bases in imaging, mobile diagnostics and monitoring equipment with now more than 4 million systems worldwide. And as part of this, this also positions us as one of the world's largest generators of healthcare data. And this has been a fundamental enabler of our evolution to become one of the leaders in digital innovation in healthcare. As a global healthcare company, obviously we follow some of the major trends that are taking place across the industry. Generally, we see there's some pretty key themes that are consistent across the world, and these are actually really getting more acute as time goes on. Despite the many advances that have taken place in medicine over the years, access to healthcare remains a major problem for huge numbers of people, with almost half of the world's population lacking access to basic healthcare. Also, healthcare resources are stretched, and there's an estimated shortage of more than 13 million trained healthcare workers worldwide. Patient outcomes, often suboptimal, and now medical errors are actually determined to be the third leading cause of death. And finally, cost constraints remain an ever-present burden as the cost of procedures and treatments rise, while at the same time it's estimated that up to 20% of all healthcare spend is actually wasted. In addition to these chronic issues, COVID-19 has had a significant impact on the healthcare industry, and this is likely to have pretty long-lasting effects. And I've picked out, three main areas in particular to highlight. First is the rise of telehealth, and there's an increasing number of consultations and treatments that are taking place virtually. And obviously, the demand for this has been created by the requirements for social distancing and the various lockdowns that have taken place around the world. But for me, what's most interesting is the unprecedented acceptance of telehealth solutions, both from clinicians as well as patients, that's really enabled this technology to become adopted so quickly. Secondly is the introduction of new workflows and protocols within medical facilities. Everywhere now, there's elevated standards for infection control and disease prevention, as well as the requirement for separate facilities for detection, containment and treatment of COVID-19 patients, all of which puts extra pressure on already stretched hospital resources and capacity. And finally, many healthcare providers are facing the prospect of looming financial challenges. COVID-19's created considerable volatility in patient demand and flow, with loss of revenues from the cancellation of elective procedures. While on the other hand, they've seen big overcapacity in acute care departments and shortage of key staff as departments struggle to cope with COVID demand. Now, over the last year or so, some of the initial challenges that healthcare providers faced have started to ease, and they've certainly got better. But if we look at the continued escalation of the COVID situation throughout Asia, many of the issues have continued to persist and in some cases have become endemic. So in order to address these existing and emerging challenges, there's rapidly a growing need for systems that can really unlock the power of data and generate actionable insights and predictions that enable better decision-making and ultimately resource allocation. Many healthcare providers today are really just at the beginning of this journey and moving towards digital health. And for many, it can be a very daunting and also confusing path. And there's lots of different technologies out there, lots of different players involved in the process. One thing that is clear, though, that in order to address the current and future challenges in healthcare, it's going to be critical to incorporate systems that are intelligent, drive efficiency, but at the same time are ultimately highly secure. To give a little bit of context for why we need these type of systems, I think the first thing to do is understand what is happening with medical data itself. Over the last several years, the volume of data generated in healthcare has just really exploded. Now, the average hospital generates more than 50 million gigabytes of data per year. Over 90% of this data is medical imaging data, and this is really driven by the advances in medical technology that have really enabled us to get a truly unprecedented view into the inner workings of the human body. But sadly, less than 3% of this data is actually analyzed and turned into actionable insights, which is an enormous waste and really a missed opportunity for driving better decision making. Furthermore, this increase in data abundance and the need to make use of it, this puts enormous strain on both clinicians and hospital administrators, and this can increase the risk of staff burnout and stress-related issues. So this is where artificial intelligence comes in. It really allows us to make use of the myriad of data that's generated every day and turn it into powerful insights that can aid clinical and operational decision-making. To harness it, we need integrated platforms that can analyze the data and apply carefully developed AI algorithms to generate visibility, insights, and predictions that can be used by clinicians and hospital administrators to help them more effectively manage their hospital operations, as well as improving clinical workflows. What you see on the screen here is the Edison ecosystem. This is our intelligence offering that comprises an integrated network of AI applications, smart devices, and data analytics capabilities. And these enable hospitals to harness the power of the data, but critically, it does it in a robust and secure environment. So to illustrate some of the applications of this type of technology, I just want to introduce a couple of real-world examples that are in use today and particularly relevant in the context of COVID-19. Although AI in healthcare is very frequently associated with clinical solutions, for example, to help identify cancers or medical conditions, AI can actually be applied very effectively to the running of day-to-day hospital operations to make them more efficient and lower cost. And our first example here is one such solution. It's known as the Clinical Command Center. This command center is a NASA-style mission control center that enables real-time monitoring of hospital operations using tailor-made viewing windows that track critical parameters such as bed utilization, ICU occupancy, staff availability, or patient transfers between departments. And by leveraging advanced AI algorithms and predictive modeling, this enables the hospital to forecast future resource allocation requirements and also streamline patient workflows, which ultimately leads to lower cost operations and also allows the clinicians to focus more of their time on delivering the best care to the patient rather than juggling capacity and resource constraints. And an additional advantage is that the data and insights can be viewed not only in the Mission Control Center, they can also be viewed on any software platform, so on a mobile phone, on a laptop or a tablet. And this makes sure that the information is available at any time to everybody that needs it. So the data in the example is from Toronto's Humber River Hospital, which is in Canada. They've seen a very wide range of benefits from the command center, including an 8% increase in their emergency department capacity and more than 45% reduction in waiting time for clean inpatient beds. It's also enabled them to effectively increase their total bed capacity by more than 35 beds without having to spend a single CapEx dollar on new physical infrastructure. And so the cost savings and the benefits that they're gaining are extremely significant for them. Our second example is more of a clinical example, and this is one that really addresses the acute needs of the ICU department. This type of system, which is known as tele-ICU or virtual care, is particularly relevant in a COVID-19 scenario and enables better infection control within the ICU, improved patient monitoring and care, and optimizes resources across the department. The virtual care platform integrates data from all the multiple devices that are monitoring the patient by leveraging AI-enabled software. And this enables both individual patient data as well as total patient population information to be viewed within a single window that's accessible from outside the ICU or, in fact, anywhere within the hospital. And so this allows clinicians to monitor their entire patient population in the ICU, both safely and remotely, while also enabling them to identify and predict those that are most at risk of deterioration in a more effective and timely manner. And ultimately, this can save lives. The system also allows real-time remote interaction with a clinician outside the ICU, with patients and staff who are inside the ICU, and connects with the EMR, the electronic medical record system, to ensure that all the relevant patient information and history is available at hand to the doctors. So a virtual care system like this ensures that patients are really given the highest standards of care, while at the same time protecting clinicians and extending the efficiency of ICU staff resources. Now, while there are major opportunities for improving patient care and operational efficiency by leveraging intelligent systems to unlock the value that's in the data collected within the hospital, we also need to address the emerging threats from a cybersecurity perspective. Today's patient care really depends on the interconnectivity of hundreds of medical devices, and as the number of devices and networks increase, so too do the cybersecurity threats. A single breach can have profound impacts on productivity, finances, quality of care, and the reputation of the institution. And you can see from the data here some of the impact that this can have. But when it comes to managing cybersecurity, healthcare is different, and medical devices require a new and tailored approach. For example, you can't shut down an MRI machine like you would a laptop to accommodate a security scan, because obviously the patient exam will be disrupted. Instead, hospitals need tailored cyber solutions that are specifically designed for medical device management. So solutions such as the one you see on the screen here are holistic cybersecurity solutions designed specifically for network medical devices. And they leverage medical device expertise, advanced technologies, and artificial intelligence to help maintain hospitals' network integrity in the face of cybersecurity risks. So to do this, it involves a strategic, systematic approach, which really enables us to assess current vulnerabilities to understand the potential risks within the network. Once these risks are identified, teams of both cybersecurity professionals, but also medical device engineering experts get involved to provide support on the ground to resolve the issues. And then once up and running, proactive monitoring for new and existing threats is provided by a remote security operations center. So as you can see, although moving towards a more connected and digital future can carry inherent risks, there are ways to manage this to ensure that healthcare networks remain safe and secure throughout this process. So in summary, just to recap on some of the topics we discussed, the key long-term challenges within healthcare continue to persist and are really quite consistent around the world. And these really including driving the need to expand access to healthcare for more people, driving better clinical outcomes, and delivering cost and resource efficiency. COVID-19 has absolutely exacerbated these challenges, but at the same time introduced unique needs and requirements, as well as also offering new opportunities. And so to succeed in the future, healthcare players must embrace new technology that provides the opportunity to unlock the mountain of data generated every day by the many connected devices throughout the hospital. But to do this safely and effectively requires integrated systems that are intelligent, efficient, and also most critically secure. So thank you for listening. I hope you enjoy the rest of the conference, and I look forward to continuing the discussion into the future. So thanks again, and goodbye.
All right, thank you, Mr. Rob Walton. And if you'd like to connect with Rob here, because we didn't have the time for Q&A segment, you can always visit GE Healthcare at their digital booth. Just click on the sponsors tab on the HMA platform and you'll be able to chat and e-meet with them. Now we've come to the end of this session, but don't go far, because in our next session, we'll be talking about the next decade of healthcare transformation, and we'll be starting in 5 minutes' time. So I'll see you there.